Greetings, and welcome to the September edition of Sepsis Chatter. My name is Sue Von Bossi, and I am the Quality Consultant for Registry Partners Incorporated. Today's presentation is called Blood Culture Collection and Acceptable Delay. The information included in this presentation is based on the CMS Specifications Manual for National Hospital Inpatient Quality Measures, discharges July 1st through December 31st, 2022. The goal of this presentation is to give the attendee the tools to 1. Abstract a blood culture collection date and time using the specified time frame parameters. 2. Determine if a blood culture was collected for the patient diagnosed with severe sepsis prior to an initial IV antibiotic administration. Or 3. Recognize if a blood culture acceptable delay exists in scenarios where blood cultures are collected following the initial IV antibiotic administration. Before we look at specific guidance, I'd like to review the data element definition and suggested data collection question. The definition: documentation of the collection of a blood culture. The suggested data collection question: was a blood culture collected within the specified time frame? The specified time frame is 24 hours before severe sepsis presentation date and time through 3 hours following the severe sepsis presentation date and time. If the initial antibiotic was administered within the 24 hours prior to the onset of severe sepsis, the time frame to review for a blood culture collection is 24 hours before the antibiotic administration time through 3 hours following the onset of severe sepsis. In order to select value 1, yes, the blood culture collection documentation must reflect one of the following: that a blood culture was ordered and collected, an unsuccessful attempt to collect a blood culture, or that the specimen was contaminated during or after the collection. Some tips to keep in mind. Blood drawn or labs collected are unacceptable since they do not specify that a blood culture was collected. A provider order for a blood culture collection is not documentation that the task was completed. Also, the latest sepsis webinar hosted by the Quality Reporting Center on June 27th of this year clarified that a blood culture collection must have a time directly associated to it. For example, documentation of a blood culture attempt or collection included in a narrative note with no time or date directly linked to it could not be abstracted by using the note open time at the top of the note. Blood culture collection date and time. For multiple blood culture collection dates and times, abstract the earliest date, time documented within the specified time frame that supports a specimen was collected or an attempt was made to collect that specimen. As we had discussed, the documentation must reflect that a blood culture was either collected or there was a failed attempt to collect that specimen. Acceptable sources include laboratory documentation, nursing notes, and/or provider progress notes. Keep in mind that if a narrative note is used, the date and time must be directly attached to the documentation that a blood culture was collected. Again, do not use the note open time. Let's move on to the next data element: blood culture collection acceptable delay. The definition: documentation supporting there was an acceptable delay in the collection of a blood culture. The suggested data collection question: is there documentation supporting an acceptable delay in collecting a blood culture? Yes, value 1, there is documentation supporting an acceptable delay in the collection of a blood culture. 2, no, there is no documentation supporting an acceptable delay in the collection of a blood culture or unable to determine. This slide includes a list of scenarios that would qualify as acceptable delays when a blood culture is collected after the initial antibiotic was administered. I think it'll be helpful to go over this list, and then we can follow up with some examples. An antibiotic that was administered for an infection prior to the onset of severe sepsis. Preoperative or postoperative prophylactic antibiotic that was administered within 24 hours before severe sepsis was identified and had a blood culture collected after the prophylactic antibiotic was started. IV antibiotics started prior to hospital arrival and within 24 hours prior to the onset of severe sepsis. Obstetric patients given prophylactic antibiotics for ruptured membranes, Group B strep, or prior to a cesarean section. Lastly, a physician, APN, or PA documented reason for the delay that makes it clear that waiting to start the antibiotic would be detrimental to the patient. The first example is an antibiotic that was administered for an infection prior to the onset of severe sepsis, and a blood culture was collected after the antibiotic was administered. An ED patient received Rocephin 1 gram IV for suspected pneumonia on 10/2/22 at 1500. The blood culture was collected after the antibiotic was given on 10/2/22 at 1600. Severe sepsis presentation did not occur until 1800 on that date. This is an acceptable delay since severe sepsis was not present until 3 hours after the patient had already received antibiotics for an infection. Note that a blood culture was documented as collected within the specified time frame. Keep in mind that if a blood culture was not attempted or collected within the acceptable time frame, this would be an OFI rather than acceptable delay. Let's look at the second example. A preoperative or postoperative prophylactic antibiotic was administered within 24 hours before severe sepsis was identified, and a blood culture was collected after the prophylactic antibiotic was started. This patient was diagnosed with acute appendicitis in the ED on 11/22/22 at 12:30. She underwent an emergency appendectomy directly from the ED. In the OR, anesthesia administered Ancef 2 grams IV immediately prior to the incision at 1300. In the PACU, the patient met the rest of the clinical indicators for severe sepsis at 1415. A blood culture was ordered, then documented at 1435. Again, this is an example of an acceptable delay. The key in this example is that the antibiotic was given prophylactically before severe sepsis was identified. Had severe sepsis been recognized and no blood culture collected prior to anesthesia provider administering an IV antibiotic, this would qualify as an OFI and not an acceptable delay. This would also be applicable to the OP patient receiving prophylactic antibiotics for a known Group B strep, ruptured membranes, and/or C-section prophylaxis. In this example, an IV antibiotic was started prior to hospital arrival and within 24 hours prior to the onset of severe sepsis. On 12/20/22, this patient was originally treated at urgent care for a UTI. The clinic MD transferred the patient to the ED for further evaluation and possible admission. According to the transfer documents, the patient received the following: normal saline, 1,000 cc's, IV bolus, 12/20 at 12 o'clock, signed and dated as administered by the clinic RN. Also, IV Rocephin, 1 gram at 11:45, signed and dated as administered by the clinic RN. In the ED, the patient met severe sepsis criteria on 12/20 at 15:30. The typical sepsis protocol labs and blood cultures were ordered and collected at 1600. It's important to keep in mind that any IV antibiotics administered prior to arrival must comply with all the required documentation that supports that it was given: medication name, dose, route, date and time of administration, and provider who administered the medication. In this last example, we would be looking for a provider documented reason for the delay that makes it clear that waiting to start the antibiotic would be detrimental to the patient. The ED/MD documented the following. The patient arrives to the ED at 12 o'clock in septic shock with hypotension due to surgical wound dehiscence. Blood cultures ordered stat. However, do not wait to administer the IV vancomycin due to ongoing rapid patient deterioration. So the IV vancomycin was administered at 12:15. The first mention of blood culture collection was an attempt at 12:40, and the blood culture was actually collected at 16:30. Note that the documentation must be an MD, a PA, or an ANP in order to be acceptable. The documentation needs to acknowledge that the antibiotic will be given even though a blood culture has not yet been collected. In this example, the documentation meets the requirement. The attempted collection would be the date and time to abstract, and we would answer yes to an acceptable delay. This concludes this month's Sepsis Chatter. This slide includes some parting abstraction tips. Always refer to the current CMS abstraction guidance to determine if the documentation of a blood culture collection is acceptable and that it occurred within the specified time frame. When there are multiple blood culture collections attempted or collected, it is acceptable to abstract an attempted collection date and time if this is the earliest documented. When a blood culture is collected after the first IV antibiotic is given, determine if severe sepsis was present when the antibiotic was given to assess for an acceptable delay. If a blood culture was collected after a first IV antibiotic was given, check for any procedure that could require a prophylactic antibiotic, such as an endoscopy, a pacemaker insertion, cardiac catheterization, or any OR visit. If a blood culture was collected outside of the acceptable time frame, whether it's greater than 24 hours early or greater than 24 hours following the onset of severe sepsis, answer value 2, no to blood culture collection. For further information, please refer to the resources below. Of interest, the Severe Sepsis and Septic Shock Management Bundle Composite Measure, Volume 5.12 Measure Updates. That's the webinar that was on Monday, June 27th. That would give some good information on blood culture collection and acceptable delay. Thank you very much for attending Sepsis Chatter today, and happy abstracting!